So this is a really exciting time for the Kling Proton Therapy Center. We're in the middle of an expansion. So by 2022, we'll have 2 machines working full-time for our patients. We're also working on a lot of research ideas, how to deliver proton therapy in unique ways, how to modify patients' treatment plans throughout the course of treatment to take into account changes in anatomy or tumor shrinkage. And so we continue to really push forward to deliver the most precise care for our patients. Proton therapy differs from traditional X-ray therapy. So when patients hear radiation therapy, they're typically thinking about X-ray therapy. Proton therapy uses protons instead of X-rays. And protons have charge, they're positively charged, and they have mass. And so we can use those physical attributes to control how deep protons go into patients' tissues. So rather than treating the tumor and the X-rays continue to pass through, we can stop protons at the appropriate depth. And that helps us treat the tumor, but spare radiation to the normal surrounding healthy tissues. Yeah, radiation is different at Siteman because of the level of expertise and the variety of technologies that we have. We really have all of the potential technologies that a patient with cancer would need. Brachytherapy, radiosurgery, proton therapy, radiopharmaceuticals. You know, coming here, you just know that whatever is needed, this place will have. And it's also in a really comprehensive cancer center full of experts through all the modalities, medical oncology, surgery. And that's how, that's why I think our patients get the highest level of care. Here at the Proton Center, we're really interested in looking at potentially changing the radiation plan every day for patients as their tumor shrinks, as their normal anatomy changes. That's called adaptive radiation. My own research looks at how radiation affects the pediatric brain. Radiation is still really important for curing many malignant brain tumors, but it's important for us to understand the side effects that it causes and the late effects for children. Proton therapy, decreasing radiation to normal tissues, is really important for children with cancer. 1 in 5 of our patients are pediatrics at the Proton Center, and we have, this really close working relationship with St. Louis Children's Hospital and the oncologist there to make sure that we're, providing the best proton therapy for kids, not only in St. Louis, but really in the region. Probably 2/3 of my practice is pediatrics and the other third is adults. And I like that mix. One day I saw a 2-year-old and a 97-year-old, and that's a pretty cool job. One of the real benefits of our center for kids is that we have a full-time child life specialist for the Proton Center to ease anxiety, introduce play and fun into the treatment. And we really use her to help decrease the need for anesthesia for the children. The more relaxed a child is, the better they can do with holding still. And so with Child Life, we've really seen a decreased need of anesthesia for kids going through proton radiation. Some of the kids just prefer to have Child Life read to them or tell them jokes or listen to music. But we do sometimes see that the kids don't want to go once their treatment is over, which is really great. They're having fun, and sometimes the parents will tell us they really look forward to coming back to treatment on Monday, which is pretty cool. To me, the special thing about Siteman is the level of specialization of all of the care teams. So this is a big place and it can be a little intimidating for patients. Fortunately, we have a lot of satellites, which makes it accessible for patients in the community. But your doctor is not just a cancer specialist. They are a specialist in your particular diagnosis, whether that's breast cancer, leukemia, melanoma, pediatric brain tumors. And that's increasingly important as cancer care advances. There's new treatments, there's clinical trials. So coming here, you really get that extra level of expertise. The Proton Center wants to be part of really helping the Siteman name, and we're really known for leaders in oncology, leaders in technology, clinical trials, and having the most advanced proton technology really fits with our mission to bring our patients the most advanced, best, most precise care possible.